My name's Ophir Ronen, and I'm the CEO of CalmWave. CalmWave is a group of dedicated clinicians and enterprise IT operations professionals who have come together to solve one of the most important challenges of our time, improving nurse retention. We do so by first addressing the problem of alarm fatigue in ICUs. This is an enormous problem. 80 to 99% of alarms that you hear in an ICU require no clinical intervention. Nurses spend over 35% of their shifts responding to alarms, interrupting patient care. And 81% of nurses report that their fatigue is due to excessive alarms. Alarm fatigue contributes to many other things. For example, 31% of our nurses are leaving the profession in 2023. 60% of nurses are reporting burnout. And an average 300-bed hospital loses between $5 to $9 million per year due to nurse turnover. Here's an example of the status quo. In this case, you're seeing one vital sign over the course of a 12-hour shift. This one vital sign generated 585 heart rate alarms. That's one alarm every 2 minutes. And if you consider that a typical ICU nurse cares for 2 patients, each with an average of 5 vital signs being monitored, this is a cacophony of noise impacting everyone, whether a clinician, patient, or caregiver. So why CalmWave? Here's the same example. In this case, what we've done is suggested 2 safe alarm setting updates during this 12-hour shift, resulting in a 98% reduction of alarms that require no clinical intervention. And we know that this methodology works because we're leveraging our success from Fortune 100 companies' alarm fatigue. Our solution requires that nurses make changes to the bedside device monitors. And what we've been able to ascertain is that for 2.5 minutes of work per 12-hour shift, a nurse is able to recover 2.5 hours of time previously spent in muting and manipulating alarms. This valuable time can be refocused on patient initiatives. So with a census of 10 patients in an ICU, that's 12 hours of nursing care per shift that's freed up and can be reallocated. Let's take a look at what this platform looks like. So one of the things that's really, really important for us is to minimize any additional workload. So for example, we provide our recommendations for safe adjustments of these alarm settings during patient assessments. So the nurse has their laptop, they roll it into the patient's room, they're doing a head-to-toe assessment and recording their notes and findings in the EMR. If there are any updates, it is at that time that CalmWave would provide those suggestions. For example, a suggestion looks like this. Kaylee Baker is the patient, room 325. There's an adjustment to heart rate. Current settings are 60, going up to 130. And our recommended update would be to go to 133. They know how to do that. They're already in front of the bedside monitor. They make the change. It's under 30 seconds to do so. They hit done. We know that that change has been made. And then as soon as we see an update from the device confirming that, that update goes away. Now, if a nurse wants to get more detail, they can just click on the update and see the specifics of not only any medication that was being provided to manage that vital sign. In this case, you can see a Versed drip and a fentanyl bump, but also we provide the understanding of why this is a safe opportunity to make this change. All of these 6 safety gates must be true before we'll provide a recommendation. And if the nurse wants a better understanding of how to make the change, not only why it's a safe opportunity, then click how to adjust, and we'll show the specific instructions of how to make the adjustments on that specific bedside device monitor, including the firmware revision. So now let's go back in. There's plenty more to the platform, of course, and we are ready for any questions. Thank you very much for this opportunity to present, and we look forward to remediating alarm fatigue together with you.
Thank you, Ophir. I'd like to invite you to join us on the Q&A session. We're also opening a poll for those of you interested in learning more about the services at CalmWave. Thank you.
So our first question is going to be, if you could talk a little more about the pilot. You also mentioned an alarm assessment. Could you share more about those, please?
Yeah, they're actually one and the same, as it turns out. So our phase 1 pilot, which is no risk and low cost, is doing a retrospective analysis of the target ICU that is to be transformed to a quiet ICU. So we pull in the data associated with the specific population to which we're going to provide new baseline settings. And then that analysis provides the hospital with a baseline of the current state of that ICU's alarms, a deep analysis of different characteristics of what those alarms are, for example, alarms by diagnoses and other things. And then finally, based on our analysis, here are the recommended settings specific for that ICU. And that is the phase 1 pilot.
Wonderful. We have a couple questions coming in. If you could just elaborate on cost with CalmWave.
Sure. So the initial cost for this assessment, doing this analysis, is $10K. And it's $10K as a bootstrap into going in and actually doing the implementation of those recommended changes. And that's sort of the phase 2 pilot. And so we've set the stage so that first we can get an understanding of what the partnership looks like, what your data looks like, so that everybody is on the same page. And then that moves to the next phase, which is a 3-month cycle with us in order to help objectively improve the noise in that ICU, right? Reducing the non-clinical, the alarms that require no clinical intervention.
Great. And could you speak a little bit to false negatives? If those, there's risk with that.
Of course.
Provider or CalmWave?
Of course. So we're acutely aware of that situation, and we've designed our algorithms to be very, very conservative. So we have no false negatives in the recommendations that we provide and minimizing false positives. In fact, we actually see significant amounts of false negatives in the existing data, meaning that there are a lot of false negatives already because of the fact that there's so much alarm fatigue. And our job is to make it so that those false negatives are eliminated, and the only actionable alarms are the ones that are heard.
Ophir, thank you so much for your time today.
Thank you.